So you've made the decision that you want to take a drug for your hypertension, or that you need a drug. That's fine. But there's some things that you should know about drugs that are used to treat hypertension. First of all, they're made by something called Big Pharma, the pharmaceutical industry. Their goal is to have you buy their drugs. They're not so much interested in whether or not that drug is safe for you. They're interested in making sure you purchase that drug. Now, if they make a drug that's a good one, that doesn't have much in the way of side effects, you're going to want to buy it. And if you're going to be on a drug, that's what you should do. But keep in mind that we always have these new drugs coming out that are designer drugs that cost a lot more than the older ones because the patents on the older ones have run out. And so what we tend to do is think, I want that new drug. Well, just keep in mind, every time a new drug comes out, you're the guinea pig for a while. So it's good to be conservative about using new drugs or using really drugs at all. Now, the biggest study that was done on determining which drug is the one that should be used, that was determined by doctors who are in practice, is called the ALHAT study. This ALHAT study was published in the Journal of the American Medical Association back in the year 2002. And they studied thousands of people and tested them on different kinds of drugs and then made an assessment about which drug is the one that they would recommend as the first line of treatment for people who have hypertension. And what they came up with was a drug that's been around for 50 years that costs less than $10 a month for an awful lot of people, that's just a diuretic that's called hydrochlorothiazide. Now, nobody much in the pharmaceutical industry wants you to do that because it takes away from the revenue. The reason that the doctors agreed that it was the best thing to take is because it was cost effective and it worked equally well to all the other drugs that are available, whether it be an ACE inhibitor, a beta blocker, a calcium channel blocker, a ganglionic blocker, or a centrally acting drug. So that was a drug that was recommended. And so you would think then that that would be the one that you want to start with. And you might, but consider that there are side effects even from hydrochlorothiazide that can be very substantial. For example, it'll raise your cholesterol. It'll increase your resistance to insulin, which means it'll put you at risk for type 2 diabetes. It will raise your uric acid levels, will put you at risk for gout, and that's why women, for the most part, get gout, because it's rare as a hen's tooth if they're not on a diuretic. It'll lower your magnesium levels, so you'll be deficient in that. That actually raises your blood pressure, and it will make you lose potassium. So this great drug that's inexpensive, that has been recommended as the drug to take, has its problems too. So we don't want to get overconfident about thinking, well, I don't have to do my part of the job. I don't need to worry about the stress in my life or the other lifestyle factors that I'm not paying attention to. Everybody who's on an antihypertensive drug is going to have side effects from that drug, because we have side effects from every drug that we take. Anything that's unnatural, that is patented, that is different than what's found in nature, that's put into the human body and it's never been there before, is going to interfere with cell metabolism in some way. And most of the time, it's not like it's just one person in 1,000. It might be 10% or 20% of people who have these problems. So, yes, there are some good drugs that are out there that need to be used in certain situations. For example, the ACE inhibitors are ones that have been used for a long time by doctors because they tend to have fewer side effects. They work fairly well. But then we found that it does cause problems with some people to have a cough that's persistent. They tend to get allergic reactions to it. It's called angioedema. Then they came out with the angiotensin receptor blockers because it didn't cause the cough, but it's in the same family generally. But now we're finding out that it causes lung cancer in a significant number of people. The beta blockers that are used tend to reduce your heart rate. And it's good for people who have angina or have heart disease or if you had a heart attack in the past. But they also cause weakness and they can make you apathetic. The calcium channel blockers similarly can have problems like that. And all the other drugs as well can. So all these drugs have significant side effects. So what you're really doing is you're picking the drug with the least side effects that might help you with some of the symptoms that you have with your particular situation, depending on whether or not you're a diabetic, whether you have low magnesium levels or potassium levels, whether you've had a heart attack or a stroke or some other kind of condition that might necessitate making sure your blood pressure is low. So if you're going to use a drug, I suppose you might want to start with the one that was recommended by the people who wrote this article in the ALHAT study. But in general, do what you can. See if you can use some lifestyle strategies, even if it's just to add to what you're taking for your blood pressure. And what you might find is that your blood pressure might come down more to the normal range, and you might not need to take those blood pressure pills that have all those side effects.